I'm Angry Bill, and this is Pre-Hospital Wisdom. We understand that medicine's medicine, but pre-hospital providers have special skills, knowledge, and culture that other providers don't have. Let's raise the bar here a little. Do me a quick favor before we really get rolling. Click the like button and subscribe. It helps more than you realize, and I would definitely appreciate it. I want to talk about who gets to make decisions. You respond to a call at the request of a police department to check out a sick case. You arrive to find an 18-year-old male without complaints. The police tell you that they need you to check him out. He's acting weird. During your exam, you find the patient to be calm and cooperative. He knows what day of the week it is, what city he's in, and tells you his name. There are no signs of alcohol consumption. He stopped taking his medications a few days ago, but he can't remember what it is that he was supposed to be taking. Medication names are hard to remember sometimes. He stopped the medication by choice, not due to running out or anything. He prefers how he feels when he isn't on it. He explains to you that there's no problem and seems to be a nice guy, but his eyes are not meeting yours. When you ask him what he's looking at, he explains that his cat is asking him to stay home. You do not see a cat. You, being a smart medic, know that this patient should probably go to the hospital. When you suggest that course of action, the patient declines. You work to try to convince him to go to the hospital, but he won't agree to voluntary transport. What do? He's oriented to person, place, time. He knows that you want him to go to the hospital, so he's sort of oriented to events. He's sober. Is he allowed to refuse? This is an example of why I hate the term sober and competent. All one word, sober and competent. That's how I'm going to spell it and say it from now on, because that's how it's said. Sober and competent. I hate the term because sober has gray areas. Competent is a legal term that's decided in court, also has gray areas. Awake, alert, and oriented times 3 or 4 is unhelpful. Decision-making capacity is what we're trying to assess. Is the patient capable of making his or her own decisions? Let me walk through each of these sentences and see if I can convince you as well. Sober is a term that's loaded with gray areas. Listen, most of us have been in various states of alcohol intoxication. I found myself completely sober, buzzed, too drunk to drive, falling down drunk, and woke up in dried vomit and not knowing where I was drunk. Which level do we care about? Can buzzed people refuse? Drunk people? Certainly not falling down drunk, right? The problem that I have is that there are gray areas in assessing people for clinical signs of intoxication. Speech clarity is subjective, except at the completely clear and completely unintelligible ends of the scale. The same goes for gait. Is a little stumble a sign of ataxia or a sign that the patient didn't see the uneven sidewalk? Supposedly objective findings like blood alcohol levels don't necessarily have anything to do with how well a person walks and talks or even drives. Most signs don't work well in assessing drug intoxication. Many people can suck down a whole joint, not slur their speech. So the term sober is pretty subjective. What we actually care about is whether a patient has the capacity to make a decision for themselves. Here's what Dr. Panelat says about competence. Quote, physicians, along with paramedics and other clinicians, commonly confuse competence and decision-making capacity. Competence and incompetence are legal designations determined by courts and judges. Decision-making capacity is clinically determined by assessment. End quote. Incompetence is a legal determination made in a court of law. Quit using the term competence, please. We don't care about competence. We care about whether a patient has the capacity to make decisions. Orientation, AAO times 4, is only the beginning of determining decision-making capacity. You're right that a person who can't tell who they are, where they are, and when they are is probably not capable of decisions. But once again, gray areas. What if a person knows that it's August and that their 10th wedding anniversary was last week, but they don't know what day of the week it is? We don't care about orientation, the 3 or 4 questions. We care about whether a patient has the capacity to make decisions for themselves. How does one assess decision-making capacity? Capacity entails 1, the ability to make and communicate a medical choice. They don't have to be able to speak, but a patient has to be able to communicate a choice regarding their care. Uncooperative silence is not communication regarding a choice. 2, the ability to appreciate diagnosis, prognosis, suggested care alternatives, and the risk benefits of all the choices. 3, can they repeat back to you in their own words what you said is going on? Did they get what you told them? They don't need to be able to teach a lecture on the subject. Can they understand their options in layman's terms? Next, the ability to make decisions without delusions or coercion. No hallucinating. No abusive husband standing behind you smacking their palm with a fist. The ability to use logical reasoning. Can they link two ideas together in a simple way? For example, heart attacks are dangerous, and if I'm having a heart attack, that would be bad. Is their plan a vaguely logical one, even if it's not something you would do? In short, people need to be able to take medical information that you give them, synthesize it into information that's meaningful to them, and make a decision based on that. Simply, does the patient understand and appreciate what's going on and communicate their choice? Sober and competent is not what you should be looking for. Decision-making capacity is the threshold that you should cross before a patient can refuse or be involved in deciding other aspects of their care. In part 2, I'll explain some of the ways that you can form an opinion as to whether the patient has decision-making capacity. Stay tuned for that. Let me know what you think of this. You can comment or send me an email to the address in the description. If you found any value at all from this video, click like and subscribe, please. One of the most helpful things you can do is to share this content with someone you know. Click here for another video, or click over here for the channel page and all videos. Subscribe's a button below. I'm Angry Bill, this is Pre-Hospital Wisdom, and until next time, stay safe.